Doing a joint replacement with MAKO robot or robotic arm is really a process for knee replacement, partial knee replacement, and hip replacement. The process starts before surgery, where you obtain CAT scan information that is then placed in a three-dimensional computer model that is then evaluated with software that I evaluate as the surgeon to help determine what position we want to put the components, how much bone we need to take away, the minimal amount of bone we need to take away to perform the surgery perfectly. And the value of this system is it gives us more information.
When I got my degree in physical education up at Weber in the 60s, I had an hour orientation on soccer. I was a soccer coach for about 15 years, and it got to the point where I could not lean down and even pick up cones off the ground. I had excruciating pain. And you know, with soccer, you use a lot of cone play and stuff like that. We were going through, actually I made it up through the season, and we were doing tryouts. And the tryouts is pretty competitive with the boys. And we had a big rainstorm that day, so there were mud puddles all over the place. And I reached down to pick up some cones, and when I did that, I fell. Dr. Hippman's office had indicated that I was going to have a robotic surgery. That's basically all I knew about it. But I came in and I did have a hip scan, and they said that they would use that scan to make sure that they did everything right.
The real value of this robotic arm is we are able to take landmarks from the patient, match those landmarks in a navigated fashion to the robot and the robot's brain and the software and computer model that we had already determined before surgery. We then use the robotic arm to make our cuts or shave the bone perfectly as we had planned before the surgery.
I came in too and checked in very easily down in the check-in area on the main floor at Lakeview, and they took me immediately upstairs to the surgical area. And now you have a joint center up there, which was really a nice place to be. The next morning they got me up and took me down to the rehab center, and I had to walk upstairs, and they showed us how to do a few exercises and things like that.
I like the robot because it allows us to study and improve orthopedics and joint replacement in general. And we hope that by being able to do this, we'll ultimately improve function and perform the performance of the implant over time. Because we know that if the alignment is perfect for that particular patient, then theoretically the components will last longer.
I'm able to get around in my car, go shopping with my wife without any problem. I was off of my crutches within, about the first week. I did go around the house with one crutch, just for support. My flexibility is getting much better already. So compared to my other hip, which took me about almost 10 weeks to really feel comfortable, I'm starting in my 6th week right now, since July 11th. And I have recovered very, very well.